Good afternoon. My name is Kelly, and I will be your conference operator today. At this time, I would like to welcome everyone to the Men in Nursing and Family Caregivers webinar. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question-and-answer session. If you would like to ask a question during this time, simply press star to the number 1 on your telephone keypad. If you would like to withdraw your question, press the pound key. Thank you. Winifred Quinn, you may begin your conference.
Thank you so much, Kelly, and good afternoon or good morning, depending on where you are, welcome, and thank you so much for joining us today. A growing number, as you may or may not know, a growing number of men are caring for parents or spouses or are finally noting that they are doing so, and the majority of those men are the primary family caregiver. Today we will hear a discussion about the unique needs of male family caregivers. Participants will identify some of the unique challenges and misconceptions facing male family caregivers, identify strategies that nurses can use to support male family caregivers, and describe the American Association of Men in Nursing's involvement and strategic plan related to men as both professional and family caregivers. Before we go any further, I do want to mention that we are recording today's webinar, so if you miss a section or would like to pass it on to a colleague, you may find the recording on our website at www.campaignforaction.org/webinars. We will take questions over the phone at the end of the webinar, and you would press star 1, as Kelly noted. And you may also, for those of you who are on via webinar, you may also type questions in the chat feature during the webinar. We will respond to those questions at the end of the webinar as well. If you opt to use the online chat feature, please be sure to send your questions to everyone. Barb, I'm now very delighted to pass the baton over to my colleague and friend, Barbara Nichols, who is a consultant to the Center to Champion Nursing in America and the Campaign for Action, specifically on our diversity work. And Barbara is also the Executive Director of the Wisconsin Center for Nursing. Barbara?
Yes, good afternoon or good morning, everyone. It's my delight to introduce our speakers. We have 2 marvelous speakers for this particular webinar, Dr. Brent MacWilliams and Dr. Jean Accius. Dr. Brent MacWilliams, in addition to being Assistant Dean and Director of the Post-Licensure Program at the University of Wisconsin, Oshkosh, is also a certified adult nurse practitioner who practices and has under his belt working as an NP with the Green Bay Packers. His expertise in clinical care provides strategic direction not only to his faculty role, but in his leadership role as president of the American Association of Men in Nursing. Our other speaker is Dr. Jean Accius. Dr. Accius is a nationally recognized expert on aging policy, livable communities, and long-term care services. He currently serves as Vice President of Long-Term Service and Support Systems and Communities for AARP. In this role, he provides strategic direction, thought leadership, and technical expertise in this arena of AARP work. Our first speaker will be Dr. Accius. Jean.
First of all, thank you so much for the opportunity to be part of this conversation today. I also want to thank our colleagues with the Center to Champion Nursing in America, as well as to Brent for his leadership and the work that he's doing with regards to men in nursing. I always like to kind of start off the conversation, particularly around family caregivers. And Christine, if you could give me right Great, thank you. We'll really just kind of set the conversation and really kind of set the tone. One of my favorite authors is Ralph Ellison, and he wrote a book many years ago, several decades by now, called Invisible Man. And I just want to kind of start off just to kind of give you a context in terms of what we're trying to do with respect to male family caregivers, and more importantly, the role that health systems, clinicians, providers, and organizations can play with respect to understanding the experiences of male family caregivers and also some of their challenges, and more importantly, how can we collectively meet them where they are. So just to kind of start off, Ralph says, I'm an invisible man. No, I'm not a spook like those who haunted Edgar Allan Poe, nor am I one of your Hollywood movie ectoplasms. I'm a man of substance, of flesh and bone, fiber and liquids, and I might even be said to possess a mind. I'm invisible, understand, simply because people refuse to see me. Like the bodiless heads you see sometimes in circus sideshows, it is as though I have been surrounded by mirrors of hard, distorting glass. When they approach me, they see only my surroundings, themselves, or figments of their imagination. Indeed, everything and anything except me. These are the words of Ralph Ellison in his piece, Invisible Man. Ellison shows, and we all know, that human beings at our deepest core want to be seen. We want our experiences validated, and we want to know that our voices matter. But what happens when you're invisible? What happens when individuals, organizations, or even professions don't see you or can't hear you? This is what it's like for the 40 million family caregivers in the United States, helping with everyday activities and personal tasks, ranging from bathing, dressing, wound care, medication management, to transportation, finances, and more. Being a family caregiver, and I should define that, that is someone who provides unpaid care to a parent, a spouse, a partner, a friend, or an adult loved one, is hard work. It is also rewarding work. And what I like to do is actually show you one of the videos just to kind of bring this to point home. Christine, could you? Right. So I'll just kind of give you some context. Andreas is one of millions of men who are providing care in this country. Men represent about 4 out of 10, that's 40%, of the more than 40 million family caregivers who are providing unpaid care. These are husbands who are taking care of their spouses or partners. These are sons who are taking care of their moms or dads. These are friends who are taking care of their neighbors. And these men are breaking stereotypes and misconceptions. Next slide, please. While the typical family caregiver is a 49-year-old woman who takes care of a relative, we know that men represent 40% of all family caregivers, as I indicated before. However, in most cases, they are invisible because our society and our systems don't seem to see them, in part because caregiving has traditionally been viewed as a woman's role. And the typical family caregiver is a woman. But we know, to Wynn's point earlier, that there's a growing number of men who are providing this care. Men, often due to their societal perceptions, often avoid talking about their caregiving situation. They don't feel comfortable talking about the emotional and economic challenges of caregiving, and they often don't seek help because of the notion of seeking help, at least in their mind, is a sign of weakness. And they're conditioned to think, oftentimes, and we know this through some of the conversations we've had with men across the country, that they can solve any problem. The issue, however, is that there are no easy solutions when it comes to caregiving, and that many men who are providing care suffer in silence. A good example of this is that we heard from men who said that, my dad taught me that men are not supposed to cry, and they're definitely not going to cry on somebody's shoulders. So such beliefs can have a lasting impact on individuals who must decide whether or not to seek the help that they need. This also has implications for industries and workers like health professionals and other service providers in terms of who comes to mind when they think about family caregivers. Next slide, please. So who are family caregivers? Who are male family caregivers? Nearly half are have some college or high school education. Over half of male caregivers are married, and roughly 44% of male caregivers have household incomes that are less than $50,000 a year. I should mention that the average age of a male family caregiver is about 48 years old, but there's great variation by age and the relationship between a caregiver and the person that they're caring for. A good example is that 28% of all male family caregivers are millennials. I'll say that again. 28% of all male family caregivers are millennials. So this is an issue that really hits across the age spectrum. Next slide, please. Nearly half of male family caregivers reported that they did not have a choice in caring for their relative or friend. One of the things that I always say is that caregiving is often done out of necessity or a strong choice to get in this space. Male caregivers were mostly providing care to an aging parent. Roughly 49% of all male caregivers were providing care to an aging parent. Oftentimes, they were caring for their mom. And over half, as Wen said earlier, are primary caregivers. The average length of time for providing care is roughly about 4 years, close to 4 years. But I can tell you that, again, that really varies by the caregiver-care recipient relationship and also the condition of the care recipient. We know from our conversations with men that who are providing care to someone that had dementia that they were providing care for a much longer duration of time. Next slide. This actually illustrates to you really what are some of the different tasks, if you will, that male family caregivers are doing. And it shows you how that varies depending on the caregiver-care recipient relationship. So you can actually see the role that millennials are playing relative to males who are caring for a spouse or partner, as well as sons who are caring for a parent or a parent-in-law. And as you can see that they're doing some very personal tasks, such as helping their loved one with getting dressed, going to and from the toilet, of course, lifting in terms of getting in and out of the bed and chairs. Next slide. They're also helping with bathing. Particularly, you can see males who are caring for a spouse or partner. 37% of them are actually helping their spouse or partner with bathing. And you can also see that they're helping with feeding and dealing with other issues. Next slide. In addition to the personal tasks, as in bathing, dressing, eating, assisting with those type of activities, we know that male caregivers are also helping with managing the finances, helping with groceries, housework around the house, and preparing meals. And again, you can see that for males who are caring for a spouse or partner, how that's significantly higher. But sons are also doing this level of work as well as with millennials. Next slide. So in addition to the ADLs and IADLs, family caregivers are increasingly performing tasks that nurses typically perform. Susan Reinhardt, who leads the Public Policy Institute, always says they're doing things that would make a nurse tremble. And that involves some of the complicated, complex medical nursing tasks, such as injections, tube feeding, medication management. And we know that this is the case for all caregivers, that caregivers are doing more and more complicated, complex medical nursing tasks, and overwhelmingly, they have not received the training or the skills to do those. In the survey with respect to male family caregivers, 56% indicated that they were doing these medical nursing tasks, but 72% indicated that no one prepared them to perform these tasks. And I always like to share this story of a colleague here who was caring for, in this case, she was a daughter caring for her mom, and she said that she was expected to give her mom injections, never being trained to do so. So whenever she actually gave her mom an injection, she wasn't sure whether or not she was helping her mom or hurting her mom. And I think that's the case for all caregivers. About 42% of male caregivers reported relative to 30% of female caregivers found that the task was difficult to perform. Now, again, this is across gender. Performing this task was difficult. I think what we learned from some of the conversations with respect to some of the focus groups we did was the fact that, for male caregivers, they just were never prepared to do some of these intimate, nurturing, personal tasks. 54% of male caregivers indicated that they experienced at least one hospitalization of the person that they were providing care for. And when we asked them exactly what would be helpful for you with respect to this challenge, about half indicated that they would like some hands-on training to kind of really help them feel more comfortable performing these different types of activities. Next slide. So in addition to just the enormous emotional and physical challenges that caregivers face, there's also the economic realities. Many caregivers, in fact, 61% of all caregivers are working caregivers, and they're having to juggle between their caregiving responsibilities, their work responsibilities, and just trying to manage the day-to-day activities in their own personal life. So as you could imagine, the challenge to find the right balancing, given everything that is going on, is challenging for all caregivers, men included. We know that 66% of male caregivers indicated that they were working at some point during their caregiving experience, and we know that overwhelmingly that being a caregiver had an impact on their productivity and their employment. Nearly 48% of male caregivers either went into work late, they left early, or took time off to provide care. We know that roughly about 15% of male caregivers indicated that they had to take a leave of absence or they had to reduce their hours at work, going from working full-time to part-time. And in some cases, some men actually turned down promotion and or retired early or just left the workforce in its entirety. While this also impacts male family caregivers, I will also say this also has implications with respect to some of the other work that we've done looking at the out-of-pocket costs that caregivers are facing. We know that caregivers on average spend $7,000 a year on out-of-pocket expenses related to providing care for the person that they're caring for, which is roughly about 20% of their income, and that is equally for men and for women. And we also know that over the duration of someone's lifetime, the fact that individuals may have to leave the workforce early or reduce the amount of hours that they work, that clearly has some economic implications long-term with respect to their retirement security. I saw one study that indicated that the lifetime income loss from caregiving can be up to close to $300,000. So clearly there's some economic implications here, and we really need to kind of figure out exactly how do we provide the support that caregivers need in order to continue to remain in the workforce to the extent to which they can while also providing the care. Next slide. So as I mentioned before, there are some strains to caregiving. Roughly two-thirds of male caregivers, indicated that it was emotionally stressful. 46% indicated that it was physically straining, given the work that they were doing. And as I indicated before, 44% experienced financial strain, particularly if you look at this population where nearly half of male family caregivers had a household income of less than $50,000 a year. Next slide. So I'm wondering whether or not we can actually show this video.
All right.
So what we'll do is we'll make sure that the videos are circulated to the participants. But what we did at AARP, we actually wanted to capture the stories of men who are providing care. And we have a range of videos that we've made available publicly. So practitioners, clinicians, healthcare professionals, organizations, and policymakers can actually hear the stories of men who are providing care and some of their challenges, with the idea that, again, this is really kind of breaking the stereotype and the misconception about the range of caregiving experiences that caregivers are facing in their journey. I had the great pleasure of being with Brent and Jason and their team at the Assembly of Men in Nursing Conference, which was, I believe, 2 weeks ago. And I challenged the group with a couple of things with respect to how can we support men who are providing care. And one was, and I will just kind of share these 4 bullets with you. The first is to remember to ask the male family caregiver, how are you holding up? What can I do to support you? With caregivers, it's easy to lose your sense of self in a caregiving role. For example, one of the male family caregivers said to us that you lose a lot of who you are because being the caregiver is front and center. And when you're in the mode, the one thing that with being a caregiver is everybody is asking how is the sick person doing? Nobody asks, how am I holding up, or if I need help or support. Because the whole focus of everything is around the person who is sick, which makes perfect sense, but over time it wears you down and you lose a piece of yourself, giving everything that you have to be as a caregiver. So since men are less likely to express the emotional and stress related to caregiving, it's critically important for health professionals, service providers, and organizations alike to really kind of prompt the conversation. How are you holding up? What can I do to support you? The second is most male caregivers have not sought help, and many do not know where to turn. Caregivers don't know what they don't know. So the question is, can they turn to men in nursing to serve as a brother's keeper and to help navigate male caregivers through the ups and downs, the twists and turns that can occur throughout their caregiving journey? It is critically important for us to find effective ways to reach male family caregivers and drive them to the resources to help them take care of themselves and also the person that they're caring for. But what that would require is an environment where they can be vulnerable. The third piece is most male family caregivers want to know that they are not crazy, that they are not in this battle alone. And this is why AARP has been so invested throughout this entire year with raising the profile, highlighting the experiences, and really trying to help men who are providing care navigate to the right resources because they are not alone. Again, men represent roughly about 40%, which is 16 million men in this country providing care. But oftentimes men who are providing care, they have a, just suck it up and do it type of attitude. And they're reluctant to acknowledge how hard caregiving is until they're actually in the caregiving, going through the caregiving journey and realizing how time-consuming and sometimes isolating this can be. While it's rewarding, it can also be extremely tough. So finally is the fact that caregivers, including men, want meaningful support. I shared with you some of what that might look like. Let it be some hands-on training. They also want information about disease-specific information. They're looking for hotlines, support groups, and networking opportunities to really kind of help them provide the care. They also want better and more clear communication and a back and forth with respects to the range of what I refer to as the care team, whether that's medical providers, community-based organizations. Really, they just want to feel competent in their abilities and knowledge to be a caregiver. And finally, I think it's fair to say that caregiving is not easy for any family member or friend, and men are beginning to realize what women have known and talked about for years, that they need help and support. As our nation's demographics shift, and so will the community of male caregivers, the population is aging, people are living much longer, family size is shrinking, which means that more and more men will be taking on roles largely unfamiliar to them. These men are stepping up to the plate in record numbers, but they need our help. They need your help. I hope you will be able to help support them, help them make the good choices that they need to make in the process of providing care. And hopefully they can lean on you throughout their caregiving journey to provide the best care and attention they can. Thank you all so much, and I look forward to the question.
So at this point, we are happy to bring Brent on board to share his presentation. Brent?
Well, wonderful. And thank you very much for that. And, Jean, it's been a pleasure spending time with you and Richard Liu at our conference. And I'd like to start off by thanking Robert Wood Johnson Foundation, AARP Foundation, and everybody at the Center to Champion Nursing in America. And especially a shout-out to Winifred Quinn, who just got off of the line, and Barbara Nichols and Jean for their support in partnership with the American Association for Men in Nursing, really to move towards the exploration of the male caregiver role. You know, recently we started to look at from a research perspective, and we're looking at the nature of the family caregiver role from the data generated from AARP studies, and also a wider research and literature perspective that includes professional caregiving. And our goal at AAMN moving forward is to identify a clear research trajectory related to best practices as they relate to men in the caregiving role. And at the American Association for Men in Nursing, we're really committed to advocating and educating and supporting our male peers as they navigate these unfamiliar waters. We really believe that we're just beginning to understand the unique ways men care and the value that men bring to that role. Women are often viewed as having an innate ability to care that is foreign to men, but I think we believe that men have the ability but need significant help and guidance in exploring, the caregiving role, whether that's from a lay family caregiver perspective or from a professional perspective. And there's a couple of things we've already identified in the research literature and recent studies out by AARP that also appear to relate to men who serve in professional nursing roles. So we started out by taking a look at that, and I think we've discovered, and I think Jean would be in agreement with this, is that men who are nurses and in a lay caregiving role provide care in a unique way. It's just different than the way women provide care and the way they communicate, and I don't think that it's been studied very much in nursing, and so because of that, I think that there's a little bit of a blind spot. And also, men have had a long history of providing care to other men. If you take a look at, for centuries in military circumstances and in religious groups that crossed millennium, the men have been providing care for other men. And also we found in an initial look at this and research that's going to be coming out, and there'll be a deeper dive on this, and we hope there's going to be publications coming out soon that involves, a joint venture with AARP and men that are on this call, and that men value autonomy and are very outcomes focused and often very pragmatic in that approach and want outcomes that are measurable, and they're task oriented and see caregiving as a set of behavioral measures that they can look at to judge if they're doing a good job. And something that Jean had talked about earlier regarding role strain, because men in the profession and in the lay caregiving role approach this from a more pragmatic way. And I think that there's a possibility that there could be less role strain as they approach this from more of a job-like perspective. So if you go to the next slide, that'd be great. So what do men who are nurses offer male family caregivers? It was interesting when I was first approached by Susan Reinhardt saying, hey, we went from 34%, 8 years ago to 40% of the caregiving in the United States done by men. What the heck are they doing? And we were supposed to be experts at it. I was in a little bit of a panic because, quite honestly, I don't know if anybody had been in nursing school who was male. I know there's people on this call that are probably smiling right now. There wasn't anything really specific about providing care to men or male caregiver perspective, or even the history of men in the profession. So I think this was kind of a blind spot. It was typically things that involved male caregiving from a professional perspective were always aligned with a disorder, prostate cancer or something else, but really nothing that had to do with any gender-specific role attainment. And I always felt that that was a little bit of a disconnect for men in the profession, and also for men that were trying to understand how other men might feel or think about providing care. And so we had to start with looking at concept analysis and trying to understand our own gender perspective as professionals about how we provided care. And I took care of both my parents until their death, and I think winged it a little bit and figured, well, I'll kind of go through this and see how it all goes, and realized I should have used resources differently. And by the time I got to my father, I was better. I had learned a lot, and learned a lot since I went through end-of-life training and spent a lot more time in the research. And so I feel more competent in this area, but still I don't think we know a lot about that. So I don't want to digress too far in my own personal experiences, but from a caregiving perspective, there's a lot to learn about the male perspective from the lay person perspective and the professional perspective. As we were talking, Jean and Richard, Lou, and I in the hallway, I said to them, and not lightly, that I thought both would be great nurses. I thought that they both had, because they had spent time with this themselves and had been involved in the family caregiving roles, how they had these unique perspectives about what men have faced who had become nurses for many years, and told Richard, Lou, tongue-in-cheek, well, if this world news gig doesn't work out, you should be a nurse. And he said, well, you told me that for the third time, and I said, well, that's because I mean it. And I mean, same, towards Jean. I think that men offer a unique perspective, and men interacting with other men could really be helpful in closing this gap. So, before I say any more about that, clearly in the research, role modeling would be something that we could offer, that men role modeling this behavior for other men, especially professionals. Men who are already nurses could be of great help. Guidance with medical and nursing skills, which men have clearly identified in the Breaking Stereotypes, Spotlight on Male Family Caregivers, written by Jean, as something that they want better navigation on. Intimate touch has been a problem in the professions, in a professional role for men, and I'll talk about that in a minute. And then social support that's men-friendly. Men communicate a little bit differently. They might go to a baseball game and hang out together and hardly exchange any words, but they might have 10 or 12 seconds where they have a conversation that's pivotal. It's just a different way of doing it. There's not a lot of, it's a different kind of communication style, but men do need to spend time with other men and understand that they have a shared view or a way of doing this, participating in caring that's unique. That really speaks to the men having a unique bond in peer support. And we really feel at AAMN that we can offer education and leadership in this area as males that are in the profession to help other people navigate that role, other men. So a couple examples would be in the article, and this has already been cited by Jean, but 23% of male caregiver recipients had Alzheimer's or experienced mental confusion. I don't think he actually brought this case up, but that was the case for Richard Lou. His father has Alzheimer's, and he really highlighted from his own experience when he presented in the Las Vegas conference how he had to get used to this idea of seeing his father in a different state, and that he pragmatically decided to enjoy that and to work in this role in a pragmatic way. I thought it was really a wonderful caregiving story, and that Jean came with a different perspective, and we all ended up commiserating in a way that's usually unique to men that get together at the American Association for Men in Nursing, or the Assembly, these groupings where we talk about how we have these unique shared experiences that you often don't see in other conferences or other things that have to do with nurses getting together. And mental health was one of the first areas in nursing receptive to men in mental health arenas. It's one of the places where men were accepted in that role and invited to the table. Men who are nurses have had a historical influence in providing care for the mentally ill. It's no surprise to us that men who are nurses could provide significant insight and guidance to the lay male family caregivers in managing those situations. It's something that men have identified historically as having expertise in. In the same article, and I think this is worth reiterating, Jean identifies that 72% of all male family caregivers who performed medical and nursing tasks indicated that no one prepared them to do so. As men in the profession, we really feel strongly that we're in a unique position to help provide male family caregivers with those skills in a men-friendly manner. You know, this more of a pragmatic approach. I think we have a great opportunity there to work together. And in fact, in 54% of the male caregivers identified in the Caregiving in U.S. 2015 survey found it moderately to very difficult to help recipients with their personal intimate care needs. Difficulty providing intimate care and or misperception of that care has really been a well-studied issue for men in the profession and has been coined suspect touch. Men, as one of those conscious or unconscious biases or a stereotype, it's been questionable men that would be in high-tech situations if there's an ulterior motive. And I wonder, and there should be research in that area to see if there's some halo to men that are providing those same type of experiences, whether there's misperceptions in that area for men that are lay caregivers or if they're just uncomfortable in that role. You know, professional male role models who successfully mastered the art of intimate touch could really potentially help male family caregivers embrace their new roles through demonstration. You know, oftentimes, as a nurse practitioner, I gravitate toward the male students to show him how I have to physically go through those motions and what I say and do as a demonstration so that they're feeling more comfortable in that role, because oftentimes when people are awkward or they're feeling insecure, their lack of confidence turns into a lack of competence from the view of the patient. So I think that's an area that we definitely have to look at and that we could improve on. And another interesting statistic is more than 58% of the men in the Caregiving in the U.S. 2015 survey indicated that they'd like a qualified person to show them how to do medical and nursing tasks, which to me seems like a very male approach. And who better than men who are nurses to help with skills acquisition? I think there's another area we could have a direct and meaningful impact moving forward. And in addition, half or 49% indicated they'd like hands-on training where they could perform the medical and nursing skills while a qualified person watched. We believe that men and nurses could help serve that unique need in a new and inclusive manner. Unfortunately, we don't really have a lot of numbers in that area because men, and work that we've done previously, either gravitate to or are relegated into more of the low-touch specialty areas like intensive care, where they're not going to have so much exposure or so much impact on male caregivers. And so because of that, I think there's a small percentage of men, we don't even have that number yet, involved in providing care at end of life and palliative care, and something that we want to focus a lot of attention on, because this millennial number that's been identified as we have students coming out of school, we really need to increase the impact that we have in the exposure to of men to areas outside of what the normal roles that they've been involved in. So if you could move to the next slide, please. So there are some issues that male family caregivers face, and many of these barriers that are similar to men who become nurses. And that is there seems to be a question about a capacity to care. And and in nursing, we've discussed this a lot about the innate ability for women to care in a unique way that's different than men, that's permeated the profession and theory and everything that surrounds nursing. And so often men are looked as a failed caregiver role or not as competent in that area and an innate ability. That needs to be challenged because men are showing up at these roles and they are providing care. They're just doing it in a different way that's often misinterpreted by people that have come from a more mainstream perspective in nursing. So, I don't know exactly how that translates to the lay caregiver role, but it's there to be studied. And as you can see, we have a lot of areas that need to be studied, a lot of research that needs to be done, and a lot of questions that need to be answered as men represent half the population and now we're doing 40% of the care. There has to be a significant movement going forward to research these issues and find out best practices and make sure that agenda is successful and that it translates to education and at where people live, and that's in our communities. So suspect touch, I've already talked about that. And this pragmatic behavior mistaken for being detached. Oftentimes men are very workmanlike about what they're doing, and I think that when I looked at the numbers and I read the initial reports is that the assumption was that men were doing things like paying the bills and driving people around. Well, it's not true. They're doing all these intimate cares and all these things that I think a little bit suffered from stereotypic ideas about men and what they would participate in when they'll do whatever is necessary to make sure that this job is well done and often do that in a very protective way. And I think with any underrepresented group, you're going to have stereotypes and unconscious bias, and I'm not going to spend a bunch of time on those topics and how there might be crossover between family caregivers who are men and men who are nurses, but we know those exist. If you watch the movies about men in nursing, the idea of sexual identity and all these other things that are really meaningless in professional roles, the failed doctor ideas and things that are in the movie, it doesn't help that we have these biases that dismiss the ability for men to do care that is meaningful. And then lastly, this protective behaviors mistaken for control. The behaviors for control, mistaken for control, I was struck when Sonny got in front of his wife in Las Vegas and got shot in the back, so which is a terrible thing, and other people that were hustling to be protective of other people in this tragedy in Las Vegas. And think those were just protective measures, and men often will participate in protective measures, especially when it becomes for a significant other like a spouse, and they can be mistaken for control when it's actually just someone who's trying to be protective. So those are some of the things I wanted to talk about. Let's go to the last slide. And that is, I want to reiterate how powerful it was to have Richard, Lou, and Jean talking about this from a male family caregiving perspective. I really felt like it empowered our conference, and for men that have been in the profession for a long period of time, sharing stories of how important it would be to spend time and commiserate together with other men and how powerful and engaging it was. And I really wanted to thank AARP for helping us make this happen and to highlight this and the campaign for action and everybody involved in this. Some of the things that I've heard from people that have called me after this conference was over was that it was powerful and refreshing and engaging, and that they were surprised that this new idea of what value men bring to nursing, and so it was a wonderful event, and I hope that we can do this again in Milwaukee next year at our next conference, because I think it really impacts. It puts it really put an exclamation point on my mind, the impact that men have in the profession, especially when it relates to helping our peers. And I just want to let you all know that at AAMN, we're committed to a research agenda to identify best practice approaches to help solve these significant issues surrounding male caregiving and help promote a culture of health that includes men. And that at AAMN, we believe that empowered male caregivers will strengthen the family and create a more inclusive and safe healthcare community. So with that, I think we've got time left here to field questions.
Yes. Thank you so very much, Brent, and thank you so very much, Jean, for joining us today and sharing your knowledge, wisdom, and insights. As a former family caregiver myself and having 3 brothers and 3 sisters, we all took turns one way or another, and I always especially think of one of my eldest brother in terms of family caregiving and all he did along with my mother and father when we were in the middle of it all. So thank you so very much. So at this point, we are happy to take questions. If you are on the phone and would like to ask a question, you can alert Kelly, our operator, by pressing star 1 on your telephone keypad, star 1, and then, of course, there's also the chat function. Christine, I don't see any questions that came in through chat. Do you? Christine, are you on mute?
It doesn't look like anybody has sent any questions through the chat function.
Okay.
So we just have to remind everyone to make sure you send it to everyone.
So, you know, maybe I'll do some intersectionality here and talk about male family caregivers and from minority backgrounds. So a few months ago I moved, and there were 4 young men from the moving company that I worked with, that I had hired, and one of the fellas who I thought seemed the most checked out that day, toward the end of the day, he asked me what I did, and I said, I work for an organization called AARP, and he said, I know exactly who AARP is, and talked about his role trying to help his uncle navigate United Health Group and the AARP product that his uncle had. And this was a young man. He's African American and is definitely in the millennial population. And so, Jean, are there unique circumstances or overlapping, or are there both circumstances for men of male family caregivers of color as compared to their white counterparts?
So that's a great question, Wen, and thank you for raising it. I have 2 responses. One is that we did some work initially looking at the data across racial groups, and one of the things that we found was the fact that while men were reported the emotional challenges, the stressors, if you will, with caregiving, it was disproportionately higher for African American men. That they just found the caregiving responsibility to be extremely emotionally stressful relative to other men who are providing care. And then I will also just kind of mention that one of the beautiful things about the video from men who are providing care that we did in Philly was that it starts off by talking. You hear one participant talk about how this is a picture that you typically don't see in terms of African American men providing care. So you have that dichotomy as well. So I think that some of the data illustrated that there are some variation with respect to the intensity of the caregiving experience that by racial groups, particularly among men. And I think the other aspect of that too is just, you know, the whole idea of how I started, that for men in general, men are typically invisible in the course of the conversation or depiction of what it is to be a family caregiver, and we know that's starting to change. So we need to do more and more, really, to create the awareness and also the support that's needed. Richard Louie said something that I thought was very interesting during our conversation a couple of weeks ago. He said that when he went to talk to his supervisor, he learned in the course of that conversation that his supervisor was also a caregiver. And Richard went to go talk to his supervisor because his dad just got diagnosed with dementia, and he was going to be taking on more and more of the caregiver responsibilities. So it dawned on me, and I said this to him, I said, so do you think in some way by you having this conversation with her that it gave her permission, if you will, to talk about her own caregiving responsibilities? And I think what that says is the fact that caregivers, there is this silent crisis, this invisible army, and what we're trying to do is give people permission, create the environment where people feel empowered to talk about their experiences and their challenges, and that might require being vulnerable to some extent, and some groups might be more willing to be vulnerable than others.
Understood. So two questions have come in, and one relates to diversity. So I'll transition to that, and then I'll also read this other one, and maybe Jean, you could address both, and maybe the second one Brent can help with. So in terms of diversity, there's also the issue around disparity of care in the rural setting, and so anything on the radar about male family caregivers and in rural areas and their unique needs?
Sure. So this is something I did not necessarily look too deeply into with regards to the report, but I do know that it's something we can definitely follow up on. We did have some questions related to rural caregivers, and we can definitely see exactly what the data tells us.
Okay.
Clearly, being in a rural area presents some additional challenges in terms of proximity and getting resources, but I don't know to what extent if that's significantly different. But I will definitely follow up with you, and we can kind of follow up with whoever raised the question or to the broader attendees.
Okay, that sounds good. And it was Neil McNaughton. Okay, and this is from Gabe, and he wants to know, what about male family caregivers and their experience in choosing assisted living or skilled nursing facilities or transitions to hospice for the people they love and are taken care of?
Okay.
So I'm assuming that there might be questions around how do they go about decision making, how do they seek information, how do they get advice, and how do they make those decisions?
So one of the things that we know with all caregivers is the fact that sometimes caregiving starts off gradually, and over time it intensifies because the person you're providing care for, their health deteriorates. Other times it can happen quite suddenly, and then you're having to find yourself make some of these challenging decisions. In the course of the conversations we had with men across the country, one of the things we learned was the fact that men typically went into their caregiving responsibilities thinking that this is something that they could actually handle. And depending on the condition of the care recipient, they found that, this was actually tougher than they realized. And some of the decisions and the difficulty was really figuring out exactly at what point in the course of providing care do you seek other resources, outside resources, either someone coming into a home to help you, or whether or not assisted living or nursing home might be an option. I know with respect to someone coming into the home, one of the things that we learned particularly from men who were caring for their spouse or partners was the fact that, they were very guarded and very concerned, if you will, about who exactly came in to the home to provide care. Clearly, between the caregiver and the care recipient, they have a dynamic in a relationship, and to have a third party come in, there's concerns about trust, concerns about safety, those type of things came up quite a bit, particularly for men who are providing care to a spouse or partner. But we also heard from men who were caring for their mom and their dad, and particularly for those who had, dementia and it got to a point where it just became very challenging for them to continue to provide the care, where they had to make the difficult decision to provide, to transition that person into a nursing home or assisted living. We do have some resources with AARP at our Caregiver Resource Center that have some guides and some things to kind of think about if you're a first-time caregiver. What are the things that you should be thinking about over the course of your caregiving journey? We also have some tools and resources to kind of help caregivers with managing their time. And then also we have some guidelines, some guides, if you will, to help caregivers kind of think through the steps and the things that they should be thinking about should they decide in the course of providing care, whether or not nursing home or assisted living is the next option. So I would encourage those on the phone and on the webinar today to really kind of visit our Caregiver Resource Center and see the series of tools and resources that we have there to kind of help address some of these questions.
All right. Thank you so very much, Jean, and thanks again, Brent. It's past the top of the hour, so we will need to wrap it up. We will follow up with you, Jean, especially on the rural health care question. And so I just want to point out to everybody, here again is our finding out how you can, to understand how you could find out about our future webinars, go to campaignforaction.org and sign up for the newsletter. And our other resources are also on the Campaign for Action, and within a couple of days or next week, we will have a summary, a very brief written summary of this webinar, and we will have a recording. Although I'm going to work with Christine to see if we could get a hold of the recording of the webinar and then embed the videos, so that once we send it out, it will have it will include the videos in it. Yes. So with that, I thank everybody. Christine, thanks so much for trying to troubleshoot our issues there. And Jean, Brent, Barbara Nichols, thank you also very much.
Thank you.
Yes.
Okay, Kelly.
This concludes today's conference call. You may now disconnect.